healthy he is, how bright his eyes are, how great his skin is, how clear his ears are, and how he has no orthopedic problems from being raised on a raw diet. So there's a lot of questions about that out there, and it's very hard to do research on raw because the box that research has been put into wants to dial down one single thing, one nutrient, one vitamin that's causing or helping, and that's not how the raw diet works. The raw diet works as a whole. So trying to give as much anecdotal or case study information as we can to guide the veterinarians and the public to understand the benefits and what we do, why we do. Dr. Pima and Jhill have been very helpful. They do some case studies for us and they document things for us, and then we put that on our website and pass on that information and hopefully help other pets. So we are a small family company. None of us ever woke up one day and said, gee, I want to be a pet food manufacturer. We actually got here. That's okay, come on in. See, we are a pet food manufacturer because we have a passion to help pets. My background is microbiology. That's what my education was. And I worked in the veterinary industry for about 15 years. Started out in conventional and moved into holistic and integrated practices. And then learned about raw diets and wanted to educate myself more about why they were so effective. My very first experience with the raw diet is I was cleaning out a German Shepherd's ear, and he was screaming. His ear was bleeding. I was laying on him to hold him down because he was biting it. And that was about the 5th time that year I was treating that dog's ear. And I had been learning about raw diets. You put that dog on a raw diet, you never got an ear infection again. And that set me off to the races going, I need to know why. So in the veterinary industry, I was interested in raw, and then I ended up getting hired by Nature's Variety, which is a raw diet on the market. And I had planned to retire with them because they were a great company. Unfortunately, they got sold. And they got sold to an investment firm, and they changed their focus from nutrition to making money, which is why most people are in the pet food industry. So when that happened, I came to this group of people who were my family, and I said, well, I'm 55, going through menopause, and the economy is really bad right now. But hey, let's put a pet food company on the market and see what we can do, because these pets deserve a truly raw diet. So that's how our company came about. So the gentleman on the top is my husband. That picture is very old. He won't give me an updated picture because he doesn't want to look his age. So he actually does what I think is the unfun stuff of the company, writes contracts, worries about taxes, does all those other things. That gentleman right there is my son. He's actually the original founder. When we decided we were going to do that, him and my sister Roxanne Stone did the investigation to see if we could financially make this work at the way we wanted to do it. So he's our CFO. My sister has her master's in nutrition and food science, which I love. Because at any time I can say to Roxanne, tell me the nutritional, how much vitamin X, Y, Z is in my food. And if I want to use these ingredients, how do I reach nutritional adequacies that I want? And that's her specialty. I already gave you my background, and then this pretty lady is an artist by trade, and she helps us with our marketing. She's currently 8 months pregnant with her second child, because she's married to him now. And so our marketing gets slowed down because of that. So it's a work in progress. But anyhow, that's kind of the background of how I got here and how Answers got on the market. So now I just want to talk a little bit about why most people want to feed a raw diet. And what I do is I tell people these are the 10 top reasons why dogs and cats go to the veterinarian. And hopefully by the end of this presentation, you'll be able to apply our food in order to how to help these conditions. One of my favorite books is Healing Pets with Nature's Miracle Cures by Henry Pasternak. He's a veterinarian that practices in Southern California. And the reason his book is interesting to me because he explains the science behind why raw works, and that's really what I want to know, not just that it works. And in his book, he says two really interesting statements that jumped out at me. 90% of our pets' health problems is due to what we're feeding them. That's really a nice way of saying that what we're feeding our pets is making them sick. Yeah. And I know nobody does that on purpose. And I lost my first Great Dane to mouth cancer, and he was raised on Purina. Okay, so I was there with everybody else because the veterinarians I was working for was telling me that was a good diet, and food, it didn't matter if the protein was coming from leather or from me, it was all the same, and my dog was going to respond to it the same way. Well, I've obviously learned differently, but nobody's really doing that on purpose, but we're not getting the information. Fortunately, you are in a situation where you have access to this organization and Julie, who are promoting a different, type of way to feed our pets, and we need to get that information out more. Now, the other thing that Henry Pasternak says is a raw diet can increase a dog's lifespan by 183%. That's almost tripling. Not too far from here, Christina Chambreau, she's a homeopathic veterinarian. On her website, she talks about the average dog's lifespan. Now, average should be 20. So that means we should see dogs around 25. Now, I have a 9-month-old black German Shepherd who's pals with Will. His picture's not up here yet. And I tell him every day, you must live to 25 because I know your genetics says you can. So I'm going to will that dog to live to 25. Now, that dog is 4th generation raw fed and weaned onto Answer's pet food. So he has a good start. He's also not vaccinated. So he has, and we don't use flea and tick and all those other things. So he has a good chance of making it to 25. I'll let you know in 25 years if he makes it. But, and she says the average lifespan for a cat should be 25. So we should be seeing cats that are in their 30s, but we don't. And we get excited if an animal lives 10 to 15 years, and it's a new normal. And it frustrates me because as Americans, we're quick to accept new normals instead of fighting for how we can make things better. So, just want to put that out there so that everybody knows what we're fighting for. Have any of you guys heard of leaky gut syndrome? I see some yes. Okay. Fortunately, this is starting to being brought to the forefront. My youngest son's a naturopathic oncologist, and I often call him for help on the pathology of some of the diseases I'm trying to deal with so I can figure out how our food can help that. And 90% of the time I go, Jacob, what do you think is the underlying reason for this problem? And 90% of the time he says leaky gut syndrome. And it's an epidemic in humans and pets because of what we've been doing to ourselves and to our pets. So leaky gut is caused, number one reason is poor diet. The other reason is bacterial imbalance. And I'm going to beat up probiotic pills and powders today because we have the understanding that we need to have this good bacteria, but I don't think we're delivering it properly. Fermentation is my understanding of how to do it. Drugs and antibiotics. We reach for them too quickly. I know when I was practicing in the medical industry, just be sure and throw an antibiotic in there just in case. It's instead of letting the body or figuring out how to help the body to heal itself. I go to a naturopath, and I had a bladder infection. She didn't put me on antibiotics. She changed some of my diet. She helped me improve my immune system, and voila, it went away. But that's not how most people will look at things because we respond to fear very much. If you don't do that, your kidneys will become infected and you'll get worse, right? Or, you'll become septic or you'll become, and I understand the fear, because if that 1 in 100 doesn't respond to the food, then you're responsible for that. So it's really hard. Toxins, stress, and vaccines lend to leaky gut syndrome. So a healthy gut looks like this. It's the gatekeeper between what you eat and what your dog and cat eats and what gets into that bloodstream. We don't think about it like that at all. I was just listening to a presentation by Doug Knieven. He's another holistic veterinarian I worked with. I didn't realize this, but that gut lining is 1 cell thick. Wow. Okay? And if that is not healthy, then things are going to get into the blood that don't belong there. So it's supposed to keep everything out except the nutrients. Okay? Now, that one layer thick of cells is supposed to be supported by the probiotics or the good bacteria in the digestive tract. It's supposed to shore them up. Think of it as grass protecting the soil, right? It won't erode if you have the grass holding it in place. So that's what the bacteria is supposed to do here. But unfortunately, that's not what's happening. This lining of the digestive tract is so broken down because of antibiotics, because of the wrong drugs, because of the wrong bacterial growth, and now things are getting into the blood that don't belong there. This is the underlying reason for allergies. I think we all understand that allergies is an immune system that's going, I don't know what to do. So I'm just going to react to all kinds of crazy things. Did you have a question?
Yeah, are you saying the lining, is it the actual casing of the intestine is one cell wall thick?
Yes.
Or the internal lining?
The lining between the blood and the digest is one cell thick. And if you don't have that probiotic protection, okay, then you have a very vulnerable digestive tract. And it's really interesting. My mother, and you'll hear about my mother later in the presentation, was having some digestive problems when she was in her 20s or late 20s, early 30s, and they did a barium series. And they watched the barium go into her bloodstream. And they said, you have leaky gut, but never did a thing about it. And that's sad. And my mom lived with 30 years of autoimmune conditions. They knew it, they saw it, but they didn't do anything because they didn't know they didn't know what was causing it, they didn't know. But that was freaky. I mean, seeing barium going into the bloodstream is a little scary. So anyhow, when things get in the bloodstream, the body has to respond because what is in the bloodstream has to be very pure, has to be a perfect pH, and only good things can be in there. If too many bad things are in there, the body dies. Okay? And the immune system knows this. So the immune system sees something in the blood that doesn't belong there, and it surrounds it with immune cells. Now it's called an immunoglobulin. Okay? The problem is that immunoglobulin can't stay in the blood. Okay? And it has to be put somewhere. So if the immune system decides to stick it in the soft tissue, now the dog is going to chew because inflammation comes along with immune cells, right? Because that's the first response to the immune system. So now the dog's chewing at its skin, and the dog is taken to the veterinarian, and the veterinarian notices because the dog's been chewing that he has a staph infection now, right? Because he's opened up, and what do you do then? Antibiotics, steroids, and what do? We just made it worse, right? And I understand we want to make our animals comfortable, okay? So we want to give them, we tend to want to go to the drug. I remember when I first started working in the veterinary industry, this black lab, she had chronic skin problems. And she had tapped out on her prednisone because her liver values were high. And I was checking the person out, and she said, I'll give you $20 if you just give me a handful of those pills. She was trying to bribe me. She couldn't sleep because the dog couldn't relax. You know what I'm saying? This was sad for everybody. So now, if that immunoglobulin gets put in the thyroid, now you got hypothyroid. That immunoglobulin gets put in the pancreas, you either have pancreatitis or diabetes. If it gets put in his kidneys, it's called immune-mediated kidney disease. Okay? So when Henry Pasternak says 90% of what we're of the ailments that our pets are seeing, this is what he's talking about. Does that make sense to everybody? So when a dog has itchy skin, instead of giving him antibiotics and steroids, we should be giving him probiotics, fermented foods, ways to fix that lining. Okay? And that's what we're going to talk about today. So leaky gut really leads autoimmune conditions, obviously when the body is starting to attack itself. Okay? That's when the immune system is at its worst. I get phone calls about people who say, my cat has to have her teeth pulled because she's allergic to her teeth. My dog's toenails are falling out because he's allergic to his toenails. Meaning his body is rejecting these things. And that's how bad we are, because it's not only the food, the vaccines, it's the flea and tick, it's the heartworm medication. And I know every time I talking about that, people go, oh my gosh, how am I going to control fleas, especially here in Maryland, because it's not as bad for me in Pennsylvania, but it's warmer here. But there are ways, and that's why I hand you that book, Dogs Naturally, and you can work with, I'm sure this organization has natural ways of doing it. So if the #1 reason for leaky gut is the wrong food. We're going to talk about our food today. And one of the things you're going to see is our entire line is fermented. So we have our what we call our additional line, which is the goat milk, the kefir, and the fish stock. We have a straight formula for dogs who have allergies. It's a limited ingredient diet. We have a detailed formula, which is a complete diet. And we have a diet for cats. You will notice that I tend to talk about dogs because I'm more familiar with dogs. I have cats. I don't know, I think they just tend to take care of themselves a little bit better.
We do have cat people here.
Okay, and so a
putting
lot
that
of
out
this
there.
applies to the cats too, so if you have specific questions for the cats, let me know. All right. All right, so the other thing you're going to notice about us is we put our food in boxes and milk cartons because we are a green certified company and we do everything that is, all our packaging is compostable or recyclable. So the number one thing that makes us different, and I told you this earlier, is fermentation. All right. Does everybody understand fermentation here? We'll do a little bit of an explanation of it. I kind of joke, it's not just making wine and beer, which is a really good part of fermentation. But it actually does a lot of things. It protects the food from bad bacteria. It creates more nutrients like organic acids, B vitamins, and enzymes. Probiotics, this is the way to deliver probiotics, and we'll talk about that. And it pre-digests the food. And this is really important for our carnivores here because we have a very long digestive tract. And that helps us absorb nutrients from our food as it's fermented in the digestive system and it gets, worked down. But these guys have very short digestive tracts. And the number one food for dogs in the wild was called carrion, and that's a name for fermenting or decaying flesh. Okay? Anybody's dog here go for really smelly things, right? Okay? Yeah, they like it smelly. They like the trash. My dogs in the past we live on a farming community, and they've brought back green slimy deer parts from the and I'm still yet to figure out why do they roll in it before they eat it. Because I know there's probably some kind of reason for that, but I wish they would just eat it and not roll in it. But that's why dogs do this. Does anybody give their dog a treat and they try to bury it in the bed? They or literally I give my dogs bones, put them outside, and then I find a hole that I usually trip in. But that's actually to ferment the bones. It's not to hide them. I think we have this concept that it's to hide it from other predators, but it's actually to ferment it. And I can tell you from experience, I had a Mastiff, and she didn't look that smart, but she probably was smarter than I gave her credit for, because 6 months later, she'd come back with that bone, and it'd be black and really smelly, or she just tripped over the hole like I usually did, so I don't know. But so I can't really talk about fermentation without at least giving credit to a couple of scientists. This is Eli Metchnikoff. The other thing I like to talk about fermentation is I like you to think about it as the fountain of youth, okay? Because what the bacteria cell does in the food is the same thing your cells and the dog and cat cells do to make energy in their body, okay? So what the bacteria is trying to do is help you and the dogs and cats not have to work so hard, and you get instant energy. And Eli was in the late 1800s, early 1900s, and the average lifespan at this time was 52 years. And he was studying cultures that were living into the 100 to 126 years. And he was trying to figure out why, and what he figured out is they were consuming soured milk, which is fermented milk. Okay? And this was very consistent. In fact, he adopted this, and he ended up living into his late 70s. So there is a direct parallel with longevity and consuming fermented food, especially fermented dairy. And we'll talk about that more. Now, this is one of my favorite scientists. Her name's Natasha Campbell McBride. And she's from Russia, and she is a neuroscientist. Okay? So she was educated in Russia and was practicing doing brain surgery, which is like probably something way above my head, right? And she decided to have a family, and at the age of 3, her son was diagnosed with autism. And this made her really upset as a mother and as a neuroscientist, because here her child has a brain condition that she can't fix. So what she decides to do is she goes back and gets another degree in human nutrition, and she puts the connection between the brain and the guts. And she ends up curing her son of autism through fermented foods. Okay, and you can read her book, because after she did this, she became so inundated with people wanting to know how she did it. She actually wrote a book, and she goes around and certifies naturopath doctors to apply this to their patients. So, excellent book, very scientific, doesn't only just talk about autism, but talks about other conditions like ADD, ADHD, dyslexia, schizophrenia, and things like that. So there's this real connection between the brain and the gut. Now, one of the things I got from her that I knew, but it hit me differently when I read her book. First of all, she says, all disease do begin in the gut, and that's her Russian accent. And she reminds us that humans, dogs, and cats, we're all a 10-to-1 ratio. For every 1 cell, we have 10 bacteria cells. Think about that. You have more DNA in your body from the bacteria than you do from your own cells. So my youngest son always says, Mom, who do you think is running the body, the bacteria or us? Now, that bacteria, that 10-to-1 ratio, is our immune systems, okay? And at the beginning of the Industrial Revolution, we got away from fermentation, we got into sterilization, we got into all these things that prevented us from re-inoculating ourselves with good bacteria. And you can see where we are. 400% increase in autism. We have Alzheimer's. We have so many of these conditions that we could be preventing, but we're not even paralleling back to the food. And this is where I keep saying food is the first medicine. So let's talk about the 100 trillion friends you didn't know you had. Now, the other really interesting thing, and I want you to think about this, especially when you're thinking about raw diets, and the reason why most people don't use a raw diet is because they're worried about bad bacteria. One of the things that Dr. McBride talks about is that she likes to see the gut have 15% bad and 85% good. Those bad bacteria have a purpose. They trigger parts of our immune system that we don't understand yet. And if we use antibiotic soap, and if we use sterilization, if we use antibiotics and even kill out those bad things, that's actually a negative for us. Did you ever hear the hygiene theory where kids that played on the farm and ate probably manure? I was just on the farm yesterday with my grandson, so don't freak out, Mom. But that is the truth. You know, I parallel this back to a movie that wasn't even very popular. It was the English fellow that used to play James Bond. What was his name? Sean Connery. And he was in this tribal country with this other scientist, and they knew that they had figured out the cure to cancer, right? They couldn't figure, and they're testing, and they got all this scientific machine, and they can't figure it out. And volcano is coming, and they got to move all their stuff. And at the very last minute, they realized the cure was something that happened when the ants got into the sugar cane that they were harvesting, and they created a chemical that cured the cancer. But everybody wants to kill the ants, right? Because you don't want your ants to sugar, right? But that was the cure. And I was at our farms recently having discussion with my farmers, and I was talking to one, and they're moving to no-till, and they're organic and not spraying. And one Amish farmer says, "Oh, the bugs, they go away, and they're really they're not that big a deal." And I started to think about that movie. What if we're killing these bugs and they're actually triggering something in the plants that are creating a chemical that we need, right? So that's how my brain works. All right. So when I want to use something for healing, I want it as whole as possible. I don't want the other parts removed. And if you know, if a bug flies in my wine, which happens all the time, I just drink the bug. So I hope that you got the gist of what I was trying to get to there. So just to make sure we all understand some of the terminology of fermentation, have you guys ever heard of the term, this food is cultured? Okay. Well, we throw around terminology that kind of is a little bit confusing, but the cultures are another name for the good bacteria. Another name for good bacteria is probiotics, right? So the food industry uses one term and the medical industry uses another term, so we can't figure out anything. They try to keep us confused. And another term for probiotics is called lactic acid bacteria. My sister, the food scientist, will say, I want to send out the food for LABs. She's testing how many good probiotics are in there. Fermentation is the actual practice, or the actual process, of the food, of the bacteria, the cultures, the probiotics, lactic acids, whatever you want to call them, eating up the food and pooping out new nutrients. And I know that sounds gross, but that's exactly what's happening. So as the food is eaten by the bacteria, it creates, first of all, organic acids. Has anyone used the goat milk and it smells sour? Okay. Well, that's because the good bacteria is taking the lactose, the sugar in the milk, and converting it to organic acids. Organic acids help digest food. So that's a good thing. Now, in our society, because we're so used to pasteurized milk, when we are familiar with sour milk, we're freaking out because that's usually bad. Okay? So really it was a little difficult for me to put this product on the market and everybody's saying, oh my gosh, I solved it, yes?
So I've noticed that it smells more and more bad as
time goes on.
Yes. Is there a point at which you shouldn't use it?
Well, the only time you shouldn't use it if you see some maybe mold floating on it, but that is very rare because the acid prevents the mold from growing. Okay? So we actually did that on purpose. Because if you took a dog that wasn't familiar with probiotics and gave them too many probiotics at one point, you're going to blow them up. And what I mean by that is you're going to cause vomiting and diarrhea. And that's not pleasant for anybody, including your pet. So what we do is we start the fermentation process in the milk. And we just get it started, and then we freeze it. And then when you thaw it, on day one, you're giving some probiotics to your dog. On day two, you're giving more, because as that milk sat in your refrigerator, more was growing. By day three, you're giving it more, day four, day five. As it gets more sour, as it gets more chunky, it gets more probiotics. That way, I gradually get these probiotics into your dog without making them sick. Does that make sense?
So if my dog gets sick when I open a new carton, does it okay at the end of the carton? That can be why?
Yeah. Fermentation is very hard to control. Okay? I've noticed that my cartons in the center of the case are more fermented than my cartons on the outside because the outside cartons get cold faster than the ones in the center. So I can't get it to perfection where they're all the same, and I just have to teach to the fact that everyone's going to be a little different. I have a customer that called me up. She goes, my dog's like the more curded ones. I'm like, I can't see through the carton. So I said, if it's not curded enough, leave it at room temperature for 24 hours, and it'll curd faster because it's going to curd slower in the refrigerator than it would room temperature. Does that make sense? So this is a living food, and we can play with it and adjust the amount of probiotics that we're providing. So the other thing that gets made is B vitamins. Does anybody drink kombucha here? Okay, I love kombucha. I make my own kombucha. We add kombucha to our food. And when I drink kombucha, I go, ooh, I feel good, right? And that's not from caffeine. That's from the B vitamins that get made by the probiotics. So those are very important vitamins for multiple different reasons. Now, the enzymes that get made from fermentation I find amazing. Does anybody know what enzymes are or have an idea? The enzymes are usually a protein and a vitamin connected together. Okay? And scientists can look at these under the microscope and they can mimic that. But what they can't mimic is the energy that's found in an enzyme, and that confuses them because they don't know how it gets there, and they can't mimic that in the laboratory. So enzymes have so much energy that it can make a chemical reaction happen that takes 2,000 degrees of temperature to happen in a laboratory. So that's a lot of energy. Okay? Now, there's a really good book on enzymes written by a Dr. Howe, and he has a theory that we're all born with X amount of enzymes. That's our energy, right? Okay, because enzymes have energy. And once we use up our energy, we die. That's his theory. So how do you preserve your enzymes? You eat enzymes so you don't have to use your own enzymes, right? So if you feed a dog food without enzymes, like dry kibble, anything cooked, then his body has to make the enzymes to digest it. If you feed a dog raw, which comes with its own enzymes, better yet, raw fermented, which comes with more enzymes, then the dog doesn't have to use his enzymes to digest that food. You see how that can create longevity then? Because you're preserving his energy. So enzymes are really interesting, and enzymes, a lot of enzymes are produced through the fermentation process. So the takeaway on this one is cultured foods and fermented foods. You can say it multiple different ways. It really means the same thing. And fermentation creates more nutrients. So there's the bacteria eating up the food. Now, the other thing that's really cool about fermentation is it protects against bad bacteria. So the number one easy, simple way is, remember those organic acids that they make? That acidic environment, bad bacteria doesn't like. So that's just a basic way. But I'm going to take you back to high school. I think 10th, 11th grade. Some close to front, some further away. Do you remember how penicillin was discovered? Okay, there was mold of an orange or something, and it dropped into a petri dish, and then like, wow, look, that mold killed the bacteria. So they started harvesting the toxins that mold make, and that's how they make penicillin. Now the problem with that is mold toxin kills all bacteria, good and bad. So that's a problem. Now what a lot of people aren't aware of is that good bacteria, your lactic acid bacteria, also create toxins that kill bad bacteria. They're called bacteriocins, okay? Now, when you or your dog or your cat consumes fermented food, you're consuming those natural antibiotics that go into the body and kill the bad bacteria. Cool, huh? Right? Now, when you take a probiotic pill or powder, they're not there. So you don't get the benefits of the bacteriocins from the probiotics in the pill form like you get in consuming the fermented foods, okay? Has anyone heard of the bacteria called H. pylori or Heliobacter pylori? It's a nasty bacteria. It's called an opportunistic bacteria, and it's the underlying reason for ulcers in humans, inflammatory bowel in dogs and cats. Well, they actually did research and found out that fermented foods, specifically fermented dairy, will actually kill H. pylori. So you have the option, if you have H. pylori in your gut or your animal's gut, to take antibiotics and kill everything, or to take the fermented dairy, like our product, kill off the H. pylori while you're populating with the good stuff, so it prevents the H. pylori from coming back. Does that make more sense? So a lot of people have lost the concept that fermentation brings these natural medicines. This is what we know. There's a lot of things we don't know yet that come along with it. Yes?
So, have you ever heard from folks that eating too much fermented food can lead to gastric cancer? Like,
I have not heard that, but I haven't heard everything. I would find it hard to believe. I know that the lifespan of the...
Peak nitric acid or something for the
I actually have never heard anything like that, but I mean, it doesn't mean it's not out there, and if you could forward me the research, I'd be more than happy to look at it, but...
I mean, second question I have, if someone is allergic to milk, can this be a good
It depends on the allergy. Some people call lactose intolerance an allergy, where it's not. Lactose intolerance is the inability to digest the sugar in milk. Pasteurization creates lactose intolerance, because raw milk comes with lactase, the enzyme to digest lactose. And I know this because my youngest son is terribly lactose intolerant, and he can drink all the raw milk he wants. So the body's not supposed to make the lactase, it's supposed to be in the milk. But when we cook the milk to pasteurize it, we destroy the lactase. So most people who are allergic to, or actually lactose intolerant, yes, can do raw milk. Now, there's a protein in milk called casein. If you are truly allergic to that casein protein, raw or not raw is probably not going to make a difference. However, when you ferment, those proteins get changed. So you may, but I can't tell you because everybody's a little different on how their allergy is set up. Now, if that allergy is secondary to leaky gut, possibly if you fix the leaky gut, you can consume the milk. But every person is different and every animal is different, so it's never the same. But we do see, you know, a lot of people who can't drink pasteurized milk can drink raw milk. It's just a small percentage that actually have a casein allergy. So, I don't know if you guys know who Dr. Mercola is. He's a naturopath, and he does have a website. It's a little bit, he likes to sell a lot of supplements, but he still has a lot of good information on there and passes on a lot of good information, and even contradicts, you know, he'll tell you right on this website, fermented foods are better than probiotics, you know, in a pill or powder. But he put out this chart, and it says, probiotics have been found to influence the activities of hundreds of genes, helping them to express in a positive disease-fighting manner. And these positive disease-fighting manners actually mimic medicine. So what this is saying is, it's very powerful. Remember we said you have more genetic makeup of bacteria in your body than you do your own genes? And we don't quite understand it, but there's a communication system amongst these bacteria, and they have a profound effect on the body, and we need to bring that back to the dogs, the cats, and the humans. So another reason I want to talk about another avenue of food as medicine that I want to talk about today, and we're going to go back to fermentation a little bit too, is called nutrigenomics, or it's also referred to as epigenetics. Dr. Jean Dodds wrote a great book on this, so if you want to learn more about it, I highly recommend you get her book. But when I was in school, many, many, many years ago, and I took genetics, they told me that my DNA, or DNA in general, was already predetermined. You got it from mom and dad, however it came together. You had no influence on it whatsoever. If you had a genetic problem, you couldn't change it. If you were genetically predisposed to getting cancer, there's nothing you could really do about it. But then in 2003, two scientists, Jhill and Waterland, realized that that is incorrect. And they call it the new genetics, and it's referred to as nutrition can override genetics. And this is a very rudimentary look at this. It's a lot more complicated than this, but here's the basics. This is their actual experiment. They took a genetically yellow fat mouse, and they bred her to a genetically yellow fat mouse. And if you remember your genetic squares, where you have two things here and two things there, and you can only get so many boxes here, right? The outcome for this should only be a yellow fat mouse, and that's what they got the first time they bred the two together. Second time they did it, they fed her differently, and they gave her certain nutrients, but they didn't give her the first time. And they bred her back to stud muffin there again. And this time they got a normal brown mouse. Yep.
Isn't it possible that they had a recessive gene and that gave them the different color mouse? I mean,
it is, but they eliminated that possibility through the way.
If it's the same two mice, I mean.
Well, I mean, they followed the genetics of these mice and bred them to be that. But you can read the research. It's in Jhill and Waterland. Okay, it's very interesting, and there's a lot more. There's besides Dr. Dodd's book, a gentleman by the name of Dr. Lipton, Lipton, I think, wrote an entire book on it. It's very interesting. Anyhow, what they had realized, up until this point, here's your cell, and here's your nucleus, and inside your nucleus is your DNA, right? And what they used to think was this was the brains of the cell. Well, what they realized is the brains of the cell was actually the cell wall. And the cell wall would look and determine what nutrients were available, and depending on what nutrients were available, it would develop a protein in the mitochondria, and that protein would actually jump on the DNA and either express the genetic or prevent the expression of the genetics, which is very interesting because it wasn't up until 2003 that they even realized these proteins were available and that they functioned this way. Yes?
Express the gene.
Or prevent the expression of the genetics.
Or what is?
Okay, so if this gene says this cell is going to be a cancer cell, if there's the right nutrients that are in the body, that protein will be made and prevent that cell from becoming a cancer cell. Does that make sense? Okay. So a lot of women choose to have their breast removed if they are the genetic markers for breast cancer. And many times, instead of doing that, if they had the right nutrients, and the problem is we don't know all the nutrients, but we do know a most recent nutrient that actually helps this protein to do this is called vitamin K2. Okay, it's a brand new vitamin that just got discovered. And we'll talk to you. Do you know about vitamin K2? Yes. Yes. And so that's this is all developing. This is all very new, but they're learning as they go. And this is why what we feed is so important, and that why we don't want to fractionate the food. Okay? So, let's talk about the fermented goat milk. We use raw goat milk. We add a few cultures, and I'll tell you why in a minute. I get a lot of people freaking out because there's honey in it. That honey is no longer in there. It's our kickstart for fermentation. So that honey is converted to organic acids. Okay? So a lot of people go, oh, I don't want to feed your milk because it has sugar in it. It really doesn't anymore. In fact, if you want to be sure it doesn't have any sugar left, just leave it out for 24 hours, and all the carbohydrates will be eaten up by the good bacteria, and then it won't have any more. Okay?
So what are you using now?
What's that?
What are you using instead of honey?
No, we are using raw honey.
Oh.
That's what we
The
do.
fermentation eats the honey.
Yeah,
It thrives on the honey to
fermentation-
destroy it.
Okay,
That-
I misunderstood.
Okay, that sugar goes in there, and those bacteria go, whoo, I love honey, and they start to grow. And then as they start to grow, they need more food. So now they move to the lactose, and then after lactose, they move to your fats and your proteins. So probiotic pills and powders will have anywhere from 1, I've seen up to 10 maybe or more strains. I'm not talking about how many colony-forming units. I'm talking about the different types of probiotics, okay? And if you drink fermented milk, it comes with 200 plus different species of probiotics. That's what they've identified so far. So I want you to think of this. Up in the teats of the goat is a bacteria makeup that's protecting the milk for the baby. When we milk those goats, all that good bacteria comes into the milk, you know, from that. Now, that bacterial makeup that's in that goat's teats is very similar to what she has in her gut. Okay? So if a dog would eat the prey of like a goat and would eat the tripe or the gut, they would be getting very similar bacteria. Now, to me, it's very important that we get the full spectrum of probiotics instead of just a handful of probiotics, because we're not smart enough to really understand why there's different strains and how those strains work together. I know one thing. I know that certain strains, that if we keep flooding the digestive tract with those 10 different strains in a probiotic pill or powder, they potentially can push out other good strains, okay? Because the lifespan of the probiotic is usually about 7 days in the gut. In other words, the research that they've done is if you stop taking the probiotic, it stops showing up in the gut 7 days later, okay? And that's important to understand too, because people ask me all the time, well, after I fix my dog's digestion problem, do I have to continue to feed the milk? The answer is yes, because you have to keep replenishing that. It's not something that you fix one time and it goes away and it doesn't come back, okay? So that's very important. Now, I put this product on the market for healing guts, like I explained, the continual fermentation that gets stronger as time goes. But I started finding out a whole lot of cool things about milk that it did that I didn't know it did. And one thing was, it fights yeast. Because I had all my customers calling me up going, my dog's belly's better and now he doesn't have yeasty ears. And my dog's belly's better and now they don't chew their paws anymore. And my dog's belly's better and, you know, it doesn't smell like Fritos anymore. I learned there's a thing called Fritos feet. So, looking at milk, it's the perfect food. There's nothing else put on earth that's meant to be consumed as food. There's other things we make food. We make animals food, we make plants food, we make things food. But the only thing that was put here to be consumed as nothing else but food is milk. And it's made by Mother Nature. We are not smart enough to know all the interworkings of this. Now, the other thing about milk I want you to think about is it's excreted from an animal. And it has a nutrient profile very similar to blood. Okay, that's very interesting to me. In fact, some naturopaths will refer to milk as white blood. I know that's kind of gross to people who drink milk. But it's when you're trying to provide every nutrient. When I decided to put food on the market for pets, I got a little freaked out because people were counting on me to make sure that I have every nutrient in my food to feed your pet, right? That's what you're expecting of the manufacturer. I don't know everything. Nobody knows everything, and if they tell you they do know everything, they're lying. Because we're discovering things and undiscovering things. In other words, we thought we had it figured out, and then we realized we didn't have it figured out. But this is the only thing that I know that I can feed to my children, to my dogs, to my cats, and to myself that is going to be the closest thing to getting everything in the body. Now, I would love to milk dogs and feed the dogs the dog milk, but I can't do that, okay? And I think Mother Nature figured that out, and she made animals who produce higher volumes of milk, and goat milk is referred to as the universal milk for mammals. If you look at the globe, 72% of the globe consumes goat milk. It's the United States that's kind of hooked on the cow milk. But it does amazing other benefits. It has cancer-fighting fats in it. It has antioxidants in it. It has, goat milk in particular is high in medium-chain fatty acids, and I'll explain how that is beneficial for pancreatitis. It's a natural antihistamine. They don't even know how it's a natural antihistamine. They know that it stops the spill of histamine, but they don't know how it does that, okay? In fact, I was reading some research the other day, and they were talking about cheese, and they know that the bacteria takes this and makes it to that, and I love this because cheese has been around since the beginning of time. They go, and we don't know how that works. And I'm like, great, you haven't even figured out how cheese is made, and you know, it's just, and that's how complicated this stuff is, and that's why it's so important that we don't mess it up, that we don't cook it, that we don't process it, and we do the least amount of damage to it, because you never can ever say, oh, well, that's not going to hurt it, or this isn't going to hurt it. I had another thought and I lost it, but I'm sure. Oh, I wanted to tell you why I use those cultures. That's what I wanted to do. So this product here, we ferment it at cold temperatures. We found 2 bacteria, and they're actually called buttermilk cultures, and that's why it's very tasty. But they will ferment, meaning they will grow at about 42 degrees. Most bacteria likes to grow at 70, 80, 90 degrees. And so what we do is we start the fermentation process at 42 degrees. We let that start to ferment. We freeze it. You take it home, put it in your refrigerator. It continues to ferment. And the concept there is if these guys are growing, the bad bacteria can't grow. Okay? So raw milk can potentially have bad bacteria. I want some of that bad bacteria there. I'm not worried about it, as long as the good bacteria is keeping it under control. And that's the whole concept of Mother Nature. Now, the other fermented dairy we have is called a kefir. And that's actually a Russian word that means fermented milk. So if you really look at my label, it says fermented raw cow milk kefir, so I'm repeating myself. But that actually has to do with labeling laws, which is kind of crazy, we won't get into. Now, kefir is different than my goat milk because it's fermented at warmer temperatures. This has extremely high amount of probiotics. I don't want to start with this product if the dog's not used to probiotics, okay? I want to move into this product if I can't seem to get the dog's problems fixed with just the goat milk, because this is a stronger product. Now, the other thing about the kefir, and that is I find interesting, is that it is fermented with a combination of bacteria and yeast. Now, bacteria and yeast don't usually get along. They fight each other. But when you get them to ferment together, they create polysaccharides that are very have healing properties. Again, they don't know how they're healing properties, but they know they are healing. Did you ever hear of kefir grains? Okay? That's not actually a grain, like a corn grain or a wheat grain, but it's the polysaccharides. You see the lumps in there? That get made when the bacteria and yeast work together. Now, Saccharomyces species of yeast will prevent candida yeast from harming the body. Now remember I told you the goat milk is also good for yeast, but that works because it's high in caprylic acid, okay? So when I have a dog or cat that's fighting yeast problems, I'm using a combination of these two products because goat milk is working with the caprylic acid, this is working with the Saccharomyces species of yeast, and we're getting different and bangs for your buck. The other thing is, my dogs get the goat milk and the cow milk kefir because they're getting different benefits from the different types of fat that are in the different types of milk. Kefir likes higher fat milk, so that's why we use cow milk to make kefir versus goat milk to make kefir. Does that make sense? Okay. All right. So I want to talk to you about a protocol that the Mayo Clinic used to use called the raw milk. Actually, they called it the raw milk cure. I call it the raw milk diet. And I learned about this protocol reading this book called The Untold Story of Milk. And there's also a website called milk-diet.com. And the protocol in this book is written by a naturopath in Connecticut. He still practices. His name is Ron Schmidt. You can see that there. It's a great book if you want to learn more about this protocol. I highly recommend you read it. And the protocol was developed by the doctor J. Crew. And he's the same doctor that founded the Mayo Clinic. And the protocol was you brought patients in and you took them off all food, all medicine, all supplements, and put them on nothing but raw milk, minimum of 30 days up to 6 months. And this was before the research box I talked about earlier was developed. So they don't really have double-blind studies on this or anything, and they stopped using it in the 1930s because the pharmaceutical industries recommended the doctors stop using it. And but they document curing a lot of different conditions, cancer, diabetes, liver disease, kidney disease. And one of the comments they make is that it was so successful that the doctors had very little interest in it. They didn't have to think about it. They just put them on milk and they got better, right? And that it crossed over diseases. Normally their protocols, this protocol helped neurological problems, this protocol helped respiratory problems, but this protocol actually crossed over and did help all those different ones. So I thought that was a great book, and I wanted my sister Roxanne to read it, and she lives in Ashland, Oregon. My mom was living with Roxanne at the time, and my mom was very sick. She was 70 years old, and she's on 12 prescription drugs. And my mom had type 2 diabetes for about 30 years. She had COPD, sleeping with oxygen. Her blood oxygen at the best was 91, and it should be 98. She also had fatty liver disease, and my mom never was an alcoholic. And in fact, when the doctors removed her gallbladder, they told her she was probably going to die from it. It was that bad. And I didn't know that till after this. My mom had kidney values were elevated. She had renal damage from the insulin in her blood. She had elevated white cells every time they took her blood. The one doctor referred to it as pre-leukemia, and he actually said, don't worry about it, you're probably going to die from fatty liver before you ever get leukemia. She had high blood pressure, macular degeneration, leg edema, and hair loss. So Mom reads this book, and she calls me up and says, I want to do this milk diet. And I laughed. And I said, I think you're going to die if you try to do the milk diet. You're on 12 prescriptions, you can't breathe, you're diabetic. You know, Mom, that was in the 1930s. And she actually fought me on it and said, her existence was getting up, reading books, going to bed. She couldn't help with the house chores. She couldn't travel. She really didn't do much of anything. So I said, fine, you're living with Roxanne, and if you die, it's on her watch, not mine. So I actually said that. I did. I was like, because I was trying to convince her not to do it. So Roxanne made a chart and made her take her blood pressure, blood oxygen, and blood sugar 3 times a day. So that if it went too far out of range, we were going to call the ambulance, and then she could explain why she's drinking nothing but milk. She actually used our product because they didn't have enough goat dairies. My mom wanted to use goat milk, and my mom liked the curds. My mom liked to taste the butter, and these curds taste buttery because of the buttermilk cultures that are in it. So she starts this, and week 1, she's detoxing. She's got gas, she's bloating, she feels sick, she's in bed, all right? And then by the end of week 2, she's feeling a whole lot better. And the whole time, her values are coming closer into normal range instead of... At the end of 30 days, my mom's sugar levels are normal, her oxygen levels are normal, and her blood pressure was normal. Like, whoa. And I thought it was luck, right? Or detox, right? Or, you know, maybe the drugs were interacting and causing most of her symptoms, right? And I'm thinking it's not going to stick. I was pretty convinced it wasn't going to stick, because that just didn't make any sense to me that this could work. And so she goes and gets her blood values drawn because she gets them done every 6 months, and her white cells are in normal range, her liver values are normal, and her kidney values drop from 178 down to 70. And now I'm like, whoa, all right, it's one thing for you to look better and for those other values to be normal, but this, it's kind of crazy. And the doctor said to her, just to be safe, stay on the medicine. and she said, no, thank you very much. I did this to get off the medicine. And so 6 months go by, and my mom consumes a pint of our goat milk for breakfast every morning and 2 low-carb meals during the day. And the really interesting thing was, week 2, I called my mom up, and I said, you have got to be starving. You're just drinking milk. Don't you want to chew something? Because, you know, to me, the pleasure of eating is chewing, right? And she goes, this is the first time in 30 years I don't crave carbohydrates. Now, I didn't realize it at the first. I dialed this in after the fact. My mom had yeast in her body. The goat milk killed the yeast, and it was the yeast that was making my mom crave carbohydrates. My mom had a carbohydrate craving so bad when she would come to visit me. We live a low-carb life after learning to live it. Wasn't, you know, not easy to do, but I would go up to her bedroom, and she would have cookies and candy and stuff hidden under her bed. And you know, my mom, I consider, she did the milk diet. She's got to have willpower, right? But these, you know, endorphins that were produced by the yeast were so strong that it just went, and that's why she was type 2 diabetic, because it was, she brought it on her own. So 6 months go by, and she gets her blood values taken again, and her A1C is perfect. Her liver values are everything's still the same. And I'm like, so my mom treks off to Europe to visit my brother who lives in Sicily. My mom now lives by herself and has a full-time job. And she's 74 now.
Wow.
And she does this once a year to reset her body.
So 6 months is 1 month.
She does 1 month of just goat milk once a year to keep her body, you know. And so this was really, you know, blew my mind. And the theories in the book are, they noticed that their patients' blood volumes increased, because we know that blood and milk are very similar. And they figured it created more nutrients, got it to the organ sites, and helped heal. Of course, it probably fixed my mom's leaky gut, right? Because she had that, so her Sjogren's syndrome and all these other problems that she was having. But this really cool thing happened to me. In the book, and my mom expressed it, it said that the patients reported discomfort in injury sites, places they had injuries, always from the oldest injury to the newest injury. Okay? And my mom had an ankle injury, and she had some discomfort there. And my mom said the place she had the discomfort the longest was in her liver. I really had no idea what that meant until I was giving this presentation to a group of veterinarians in Pennsylvania, and the one veterinarian came up to me afterwards and said, I'm going back to school for stem cell research. And I said, ooh, that's cool. You know, biology at its best, right? And he said, you know, there's stem cells all over the body, and we don't know how to trigger them. And he says, I suspect the milk diet triggers the stem cells to possibly heal the body. That, wow, pretty cool.
Right, so even for humans, once if we test and make sure that we're not allergic to casein, then anybody that is not